As a kid, I was always told, sticks and stones may break my bones, but words will never hurt me. But will negative words actually affect your treatment outcomes? Or is it the context of those words that actually matters? In this episode, we'll discuss Nocebo language. Recently, there's been an emphasis on decreasing the number of nocebos used in clinical practice, especially when it comes to words used in conversation. So we're all familiar with what a placebo is, and a nocebo is the opposite of that. So a placebo is a positive outcome that's not related to the actual active treatment, where a nocebo is the negative outcome from a treatment. The focus is commonly on the actual words that are used and not the context in which they are used. So some of the words that are commonly attributed to a nocebo are like degeneration or degenerative, weakness, instability, chronic pain, or even just like wear and tear or a torn muscle or ligament. While it's important for us in healthcare to foster a positive environment, sometimes I think the pendulum has swung a little bit too far, especially when we're talking about nocebo language. For example, in practice, we can say that our goal of our treatment is to increase the tolerance of our tissues to load through the use of exercise. And while that's a great statement and it doesn't include any nocebo language in it, and so it doesn't suggest a negative outcome, to the patient, that statement doesn't really make a whole lot of sense. In fact, for the patient, that statement's probably going to boil down to that their tissues aren't strong enough to tolerate whatever they want to do, or that their tissues or joints are too weak for their activity, and so they need to strengthen them by using exercise. So I think it's important that we use language that the patient is actually going to understand, as long as we put it in a context of how we're going to achieve and how we're going to recover from that issue. So in the example, while we said that, their tissues are weak or that they're not strong enough, we can strengthen those tissues by using exercise. So we're avoiding using negative expectation or setting a patient up for a negative outcome by telling them what we can do to help them. And this mirrors the research on nocebos. So in the research, what they do is they set the expectation that their patient is going to have a negative outcome. So they might give a medication and tell the patient that this medication is actually going to increase their pain level, or they're going to say that they're going to stop a medication that is specifically used to decrease their pain. So in both scenarios, they're explicitly telling the patient that there's going to be a negative outcome versus just using a simple word like a medication or a fever or something like that that's influencing the negative outcome. And this leads into some interesting research on open and hidden interruptions of treatment. So this kind of sheds some light onto placebos and nocebos. So what a open interruption of treatment is let's say that we have a patient and they're on morphine post-surgery. And in an open interruption of treatment, the doctor will specifically say, we're going to stop the morphine in the IV, and so after this time period, you're going to have no more morphine. Where a hidden interruption of treatment, the doctor wouldn't tell them, and so the patient would be unaware that there's no more morphine in the IV. And what this research study had found is that those who had been told that they weren't going to be receiving any more morphine, 10 hours after that point in time, they actually were requesting more morphine compared to the group that was unaware that there was no more morphine in the IVs. And what this tells us is that the expectation of pain, because the group that had been told that they weren't going to receive any more morphine, that they had an expectation that they were going to have more pain, and so afterwards they were requesting more pain medication. Whereas the group that didn't know, they didn't need as much because they weren't expecting any more pain because they thought that morphine was in there. There's ethical issues in there, and that's why nocebo research is hard to do. But it does show us a little bit of insight into the expectations of a treatment. In summary, the expectation of a negative or a positive outcome can definitely be influenced by words, but it's not purely because of a specific word that is used. The context in which those words are delivered in communication matters a whole lot more than those specific words that are chosen. Thank you guys for watching this episode on nocebos and language. I hope that you found this information useful. If you did, go ahead and give this video a big thumbs up. If you want to see more of my content, go ahead and hit that subscribe button, which I'm gonna say it's over here, but you know, it could very well be over here. Wherever that red button is, go ahead and hit that subscribe button, and I'll see you guys in the next video.